Stepping Up Physical Therapy with Tayler, who is a physical therapist here. Tayler, let's start off first with Stepping Up. What makes Stepping Up so special to you and to all the clients here?
So I really think that Stepping Up has a unique culture and community when you walk through the doors. You will feel that as soon as you walk through our doors. So there's just a good vibe, there's a good atmosphere, and the patients are enjoying themselves.
Yes.
We get to work with patients one-on-one every time that they come in, which I think really sets us apart to be able to get to know the person, not just physically what's going on, but who they are as a person and how life experiences have impacted what they go through.
Yeah, just that simple. You get to really get to know the patients, which is special. So, and today we're talking about pelvic floor physical therapy. Correct. You said that was broad, but what is that?
Yes, so pelvic floor physical therapy is unique in that it is looking at the pelvis. So the pelvis is a bony structure, but it's also kind of like a bowl with a muscle layers at the bottom called our pelvic floor. That pelvic floor has so many functions, one of them being support of our internal organs, reproductive organs, and it plays a huge role in bladder incontinence, bowel incontinence, sexual function, all different types of diagnoses that are unique to that pelvic floor.
Yeah, and one topic we're talking about today is something that I believe a lot of women, especially later in life or maybe after they've had a baby, they do talk about. What is that?
So that is called urinary incontinence. Basically, we should be continent. We should not be losing urine involuntarily. So it should be something that we are able to control and be in control of our bladder. Oftentimes I'll describe it that when you have incontinence, your bladder is in control of you versus you being in control of your bladder. And so what we really do here is a conservative treatment to be able to improve the muscle strength and function of the pelvic floor as well as the bladder, so that women can gain that independence to be able to not have to rush to the bathroom or lose urine on the way to the bathroom. They are able to withhold that, and so that they're not having to use urinary pads throughout the day. It gives you so much more quality of life back, and to be able to be in control of that and get more quality back in your life.
Absolutely. And here at Stepping Up, what ways do you work with these patients maybe who are going through this?
Sure. So we always get them set up with a women's health specialist. So there's several of us in the company, and so we evaluate them. So we get to know them. We hear their story, how this has impacted their life, and kind of where it all started. A lot of times you think, oh, I've had to have a baby to have this, but that's not true. Athletes can get this. Women who are older, who have gone through trauma, anything can lead to urinary incontinence. And so we sit down with them, hear their story, and then from there develop an individualized treatment plan for that patient.
Wow, that's amazing. And Tayler, I think there's so many people who have questions too, who say, you know, I might be dealing with this or maybe something else. You guys are just a phone call away, right?
Correct. Correct. Yes,
simple.
phone call or email you can get on our website. Look at who the women's health specialists are, which one is closest to your area. Email us, call us. We are here for everybody.
Absolutely. And one more question too, is physical therapy just for those young people in life, or is it really for any age?
Right. So I hear a lot. Patients will come in and be like, I think I'm too old to fix this. I don't know if you can do anything for me, but I always encourage people that age, while yes, is a factor that we want to consider, it does not mean that all hope is lost. Giving input to those muscles is always possible. Gaining strength and function of those muscles is possible at any age. And so hope is never lost. That's what I always say. I want people to leave here with hope that this is not what they have to go through for the rest of their life.
I love that so much. Really giving everyone that purpose again, or at least that's what you hope to do. So thank you so much for having us here. And if you are interested in Stepping Up, this place is fantastic, and that information is on your screen right now.